ACE, or Adverse Childhood Experience, there's a questionnaire that has been used. It first started actually in the Kaiser HMO population and now has spread to many different groups using it in the world. And they ask about abuse, and Dr. Drossman has studied more abuse, physical, emotional, sexual, but there's also other types of adverse childhood experiences: neglect, physical neglect, emotional neglect, and also adversity that occurs in the household. Not did you know someone growing up who had mental illness or died? No, it's someone in your household that's really going to have more impact on that individual as they grow up. And many of these adverse childhood experiences have been increased in individuals with IBS. And when they studied ACE in these large-scale studies, it was interesting. They did not study GI disease, but we were able to study that, at least with IBS. And there's different studies, but at least 2/3 of individuals with IBS will report at least one of these ACE. And there's a greater relationship. And this is also with other conditions. So if you have adverse childhood experiences, it increases your risk, not just of IBS, obesity, depression, lung disease, cardiovascular disease, diabetes. So it just shows you that having adversity early in life, when you're maturing and developing your adaptive systems like immune system, behavioral, cardiovascular, GI tract, it gets disrupted, it doesn't mature as well, and you're more prone to getting a breakdown and leading to illness. I will say, though, that this is probably more the exception than the rule. It increases your vulnerability to getting diseases. However, many of us will have experienced these ACE, but we don't get these conditions. But the more you have, the higher likelihood you have to have illness, including IBS.